Okay, so hello everyone. So to continue our discussion regarding the virology, let us now start with the diagnostic. So kanina na-mention po natin yung about the direct microscopy wherein we were said that it is the least sensitive among all the diagnostic procedures for your viruses. However, it is the one that is readily available and also it is accessible. So now let us proceed to the next procedure. That is what we call the viral culture or cell culture. So commonly, our viruses in the laboratory, they cannot be cultivated and cultured in your synthetic media. Again, we cannot use synthetic media to let our viruses grow. Instead, we make use of viral culture or cell culture. This is said to be the gold standard for virus detection. Again, your viral culture or cell culture is the gold standard for virus detection. Pakisulat na lang po dito, gold standard. With that being said, your viral culture has different types. We have 3 types. We have the primary cell culture, pakibilugan na po, diploid and continuous cell line. Okay, so again, yung mga viruses po natin, they cannot be grown in the synthetic media, kagaya ng mga bacteria na may mga BAP, CAP, blood agar plate, na may mga broth, na may mga liquid broth. Ayan, hindi po sila tumutubo doon. But rather, we make use of what we call the viral culture or cell culture. So we have different types. Number 1, we have the primary cell culture. Okay? So ang primary cell culture, it make use of normal mature adult cell. Again, normal mature adult cell. Take note niyo po yung adult cell. It make use of normal mature adult cell. So ibig sabihin kapag ka po normal mature adult cell, as we all know, habang tumatanda yung cell, mas nagiging limited lang po yung kanyang capacity to divide, to cell divide. Okay? Kapag primary cell culture na gumagamit ng normal cell adult, usually yung passage niya is once or twice lang kasi medyo adult na, matanda na po yung cell na ginamit. Okay? So primary cell culture, however, is the most common and kidney cells are used for coming from the mesos monkey or rabbit monkey. Kidney, sorry, rather. Mesos monkey or rabbit kidney. Okay, so example po natin dyan yung primary monkey kidney cells. It is excellent for the recovery of your myxoviruses. Yan, yung mga tinatawag natin na orthomyxoviruses or even yung mga tinatawag natin na paramyxo. Okay, and may support the growth of adenovirus, your RSV, measles, and then your AGMK. Okay, number 1 po, primary cell culture, normal adult cell, normal mature adult cell. Take note po. Number 2, another type of your viral cell culture is what we call the diploid cell line or semi-continuous cell line. Okay? The diploid cell line or semi-continuous cell line. Ang difference naman po nito with the first one is it uses young, active, many. Okay? Young, active, and many cells. Young, active, and many cells. So that's why kung young and active yung cells na ginagamit natin, mas marami po yung chance na mag-divide siya. Okay? Yung passages nung cell can be up to 50 times. Okay? Anong difference niya with primary cell culture? Si primary cell culture, yung passage, it can be done ng once or twice. Kapag young and young pa yung cell line coming from the diploid cell line, it can be up to 50 times for the passage. Okay, so if your diploid cell line is taken from embryonic tissue and usually fibroblasts from the lung or the foreskin. Okay, and then example natin dito si human fetal diploid for the isolation of your varicella zoster virus and then your HSV. Okay, take note na din po dito, lagyan po ng underline. Example po natin dito also si human diploid fibroblast, HDF. Human diploid fibroblast. Okay, lagyan din po ng star. This is a recall question in the board exam that is for the isolation of CMV or cytomegalovirus. Okay, again, under diploid cell, meron tayong tinatawag na human fetal diploid for the isolation of VCV and HSV. We also have what we call human diploid fibroblast, HDF. Lagyan na po ng star, HDF. That is for the isolation of your CMV. Okay, next naman po natin si number 3, which is the continuous cell line or heteroploid. Continuous cell line heteroploid, that is for your tumor or malignant cell. Tumor or malignant cell. Okay, so for tumor or malignant cell, ibig sabihin, di ba po, kapag malignant yung cell, meron siyang continuous proliferation. Dumadami po siya, non-stop. Okay, so ibig sabihin meron siyang unlimited na passage, indefinite yung kanyang passage. Lagay niyo po dyan, indefinite passage. Okay, so yun yung difference niya with those two who have mentioned above. Okay, so continuous cell line, yun yung mga tumor or malignant cell natin that can have indefinite passage or unlimited since yung proliferation nga po ng mga tumor cells or mga cancer cells are continuous. Okay, so example natin dyan, si hepatocontinuous cell line for the isolation of the adenovirus, HSV, RSV, HeLa cells. And then these are coming from or derived from your cervical cancer. Cervical cancer. Pakilagay po sa underline, cervical cancer. Okay, pagka yung mga HSV, pero pag RSV, saan po ito nanggagaling? Usually, they are coming from laryngeal cancer cell. Larynx, laryngeal cancer cell. Laryngeal cancer cell. So again, for adenovirus and HSV, HeLa cells are derived from cervical cancer cell. Pag RSV, laryngeal cells. Excuse me po. Okay. Next po naman po natin is what we call the KB. KB is coming from nasopharyngeal cancer cell. Nasopharyngeal cancer cell. Nasopharyngeal cancer cell. So next term is what we call the CPE. Di ba narinig niyo na po kanina si cytopathic effect. Okay, ibig sabihin po niyan, there is a change in the nucleus or cytoplasm due to the presence of virus. So again, sabi nga po natin, we cannot observe or see or detect or isolate your viruses in the synthetic media. However, meron tayong grading or ano yung parang indicator natin na talagang may presence ng virus. That is the cytopathic effect, wherein we will observe for a change in the nucleus or cytoplasms if there is a presence of virus. Yun yung grading natin. Okay? That is the cytopathic effect. So your cytopathic effect are examined through microscopy, which is phase contrast. Lagyan nyo na po ng star. Your CPE or the cytopathic effect that can be observed in the what we call the changes in the cytoplasm or nucleus can be observed under phase contrast microscope or what we call inverted light microscope. Lagyan nyo na rin po ng star yan. Lagyan nyo na po ng star. Okay, so these are some of the examples of your CPE or your cytopathic effect. We have what we call the pycnosis. There is a shrinkage of nucleus. Shrinkage of nucleus. Sulat nyo na po. Shrinkage of nucleus. So saan po usually makikita ito or ma-observe? Usually we can observe this in your enterovirus. Enterovirus po. Okay, pycnosis, shrinkage of cell in the enterovirus. Next, we have what we call the formation of fused cells. So for number 2, formation of fused cells or yung tinatawag natin na syncytia. Okay, syncytia. S-Y-N-C-I-T-I-A. Syncytia. Okay, so natin siya ma-observe sa mga RSV. Respiratory syncytia virus, RSV. Next, cytopathic effect is the vacuoles. Okay, vacuoles in cytoplasm. There is a foamy degeneration. Foamy degeneration. Okay, hindi po naka-include dyan. Lagay nyo na din po sa number 4 if may makita ka na presence or ma-observe na swelling and clumping of grape-like cluster. Swelling and clumping of grape as in grapes. Okay, yung mga violet na grapes natin na prutas. Grape-like cluster, that is for your adenovirus. Again, swelling and clumping of grape-like cluster, that is for adenovirus. Okay, still, nandito pa rin po tayo sa viral cell culture. Okay, next we have on what we call the heme absorption. It is for observe these for viruses with little or those that do not produce CPE. So again, sabi nga po natin, i-grade natin sila according sa kanilang CPE. However, may mga viruses po na maliit lang yung or hindi masyadong halata yung changes nila with the nucleus or the cytoplasm. Hindi natin sila easily observable. So kaya po doon papasok yung tinatawag natin na grading of the CPE. For example, kumuha ka ng 50 cells or 100 cells. Tapos i-inject mo yung virus doon. Tapos tingnan natin ilan doon yung nagkaroon ng effect or nagkaroon ng changes. Paminsan kasi hindi naman observable. So at least mag-grade natin if there's a 1 to 25%, 26 to 50%, or 21 to 75% that exhibited CPE, we can definitely grade them. And according to their intensity. Okay? According to intensity. If pag may nakita tayong mga shrinkage, yung mga kagaya na nabanggit natin dito, yan sila shrinkage. If meron din po tayong nakita na cytopathic effect na nagkaroon ng foamy degeneration, ang tawag po natin doon is qualitative grading. Again, qualitative grading. If kapag ka po meron na tayong ganitong grading sheet, this is what we call yung quantitative grading. Quantitative grading po. Okay, so the rapid shell vial culture, pakilagay po sa underline that there is rapid modification of traditional cell culture. Rapid modification of traditional cell culture because there are a lot of viruses that takes a longer time to produce CPE or hindi halata or little lang po yung production ng CPE. So ano ba yung mga example ng mga yon? Sila CMV and VZV. Okay, sila varicella zoster virus. Okay, so we make use of this. Also, the interpretation of the FITC, this is the direct and indirect viral antigen injected or that can be placed in your serum. Viral antigen in your serum. Okay, so meron tayong mga intensity grading for that one. Okay, next naman po natin is the serology test. Okay, sa serology test, it is to know the immune status of the patient. So, kanina may microscopy na po tayo. May cell culture. Okay, so ginagawa yan sa lab. Pagka po meron kayong time, try nyo i-google kung paano po ginagawa si cell culture. Also, we have the serologic test or to know the immune status of the patient. So, we have classic techniques for that one, yung mga radioimmunoassay natin. We have on what we call yung mga particle agglutination, the Western blot. Okay, yan. Yan yung mga ginagamit natin for that one. Next, another type of diagnostic procedure is what we call the molecular procedures or your PCR or the polymerase chain reaction. It is a very sensitive procedure to perform and to know the presence of the viruses. However, ang disadvantage niya or ang downside niya is the cost. Mahal nga naman po. Okay, ang costing nitong pagpapagawa ng ating PCR testing. Okay? Also, it requires a higher degree of operator skill. So, you're not just only investing in the machine equipment and analyzers or even the reagents, even for the engineering part or the physical building and even in the trainings of the technicians. Okay? It requires a higher degree of operator skill. Okay, so it is truly reliable in a sensitive test. However, yun yung kanyang disadvantage. Okay, so pumunta na po tayo sa last part ng discussion natin, which is the differentiation or different identification of different viruses such as DNA and RNA virus. So mapunta naman po tayo sa DNA virus. Okay, so sabi daw po, lahat ng mga viruses na alam mo are RNA except for these following. Okay, lahat yan mga RNA. So meron tayong tinatawag na H-happy. H-happy, ito yung mga family or what we call mga family ng viruses that are included in the DNA virus. We have the letter H, the Hepadnaviridae, H, Hepadna. Yung H sa happy, Hepadna naman ito, Hepadna, ito herpes viridae. Herpes viridae. Next naman po natin, adenoviridae, si A. H happy. Yan. A. Adenoviridae. Yung P, unang P is poxviridae. Yung next na P, parvoviridae. Next na P, poliomaviridae. Okay. Next na P, papillomaviridae. And yung I sa dulo, iridoviridae. Okay, so again, yung H happy natin, these are all DNA viruses. We have Hepadnaviridae, herpes viridae, adenoviridae, poxviridae, parvoviridae, poliomaviridae, and papillomaviridae. Okay, so all of your DNA viruses are double-stranded DNA except parvovirus. Okay, parvoviruses. And all of them are icosahedral except pox viruses. Okay, remember meron tayong helical and icosahedral na shape, okay, in the capsid. However, yung inyo pong tinatawag na pox viruses are complex capsid. Complex capsid po yung mga yan. Next, all are envelope for the DNA viruses except PAP. Okay? PAP. PAP, ano po yung si PAP? Papovavirus, adenovirus, parvovirus. Papova, adeno, parvo. Okay, next naman po natin, ang general rule is that your DNA viruses multiply in the nucleus. However, may exception. That is for the pox virus. Your pox virus is a DNA virus that replicates or multiply in cytoplasm. Okay, so take note na lang din po, the smallest DNA virus known, smallest known DNA virus is what we call the parvovirus. Okay, smallest DNA. Pag largest, pox virus. Smallest, parvo, largest, pox virus. Okay, so next naman po natin is yung virus family na. So virus family for the Hepadnaviridae, it is known to cause your hepatitis B virus, and then the infectious unit is called Dane particle, D-A-N-E. D-A-N-E, Dane particle. And we have two important antigens for your Hepadnaviridae. We have the surface and core. Surface and core. So the surface antigen is termed as Australian antigen, and then your viruses for the Hepadna is not isolated in the culture. So we usually perform serologic tests for this one, okay, for Hepadnaviridae. So what are the diseases known for Hepadnaviridae? We have Hepa B, chronic and acute, fulminant hepatitis with rapid liver destruction. Next naman po natin si herpes viridae. Herpes viridae, the most prominent feature is its latency. Okay, latency or latency. So anong ibig sabihin ni latency or latency? It is the ability to produce infection that can be affected most or in months or years later. Okay, so it is the ability to produce infection months or years later. So, ibig sabihin, pwede ka pa pong ma-infect ulit ng iyong herpes virus even though nagkaroon ka na po in the past. Okay, so the subfamily Alpha herpes virinae, number 1 herpes virus, we have HSV1. HSV1 and HSV2. So, anong difference nilang dalawa? Si HSV1, it is for the oral strain. Okay, oral strain. Ibig sabihin yung mga lesions, they happen above the waist. And this on the upper extremities. Meanwhile, si HSV2, this is for the genital strain wherein yung mga lesions, it can manifest below the waist. Okay? And then next, yung target cells po natin for the herpes viruses ay yung mga tinatawag natin na mucosal cell. Mucosal cell. Mucosal cell. Okay? So, the site of latency is sensory nerve ganglia. Sensory nerve ganglia. Okay, so what are the diseases associated with your herpes viruses? We have the cold sore, herpes labiasis, the gingivomastitis, conjunctivitis, encephalitis, genital and neonatal herpes. Okay, so next naman po natin si varicella zoster virus. Varicella zoster virus, the target cells are also mucosal cell. And the skin site of latency is what we call the dorsal foot ganglia. Dorsal foot ganglia. Okay, so si varicella and si zoster magkaiba yan. So si varicella, it is known to cause chickenpox. Okay, si zoster naman siya yung nagkukos ng shingles. Si shingles yung pag matanda ka na or naulit na yung chickenpox mo. Okay, this is the recurring form, si zoster. Si varicella, si zoster. Okay, so the route of infection is if the person had a contact with the lesions. Contact with lesions. Okay, next naman po natin. Okay, next naman po natin is your subfamily beta herpes virinae, which is the cytomegalovirus or the CMV-HH5. It is formerly called as the salivary gland virus. Salivary gland virus. Okay, it is the most common pathogen that causes mental retardation. Most common pathogen that causes mental retardation. So again, it is formerly called as salivary gland virus. What else? Yung ating pong cytomegalovirus or the CMV can remain latent with WBC and endothelial cell. Nakalagay yan dito. Okay, so the target cell or site of latency is what we call lymphocyte. Okay, lymphocyte. It may reveal the characteristic of owl's eye. Pakitandaan po yung owl's eye. Lagyan na rin po ng star appearance. Lagyan ng star. Okay, it is isolated from blood, urine, and throat. And then the mode of transmission is organ of transplantation, blood transfusion, or transplacental. Okay, it can be passed from mother to baby. So, ibig sabihin yung mga immunoglobulins that can cross through the placenta. Okay? And then in adults, the CMV may cause syndrome similar to mononucleosis. Mononucleosis, heterophile negative mononucleosis, and may infect okay, wait lang po. So again, going back for the cytomegalovirus, in adults, it may have a syndrome similar to mononucleosis and heterophile negative mononucleosis and may infect the kidney that may shed in your urine. So also, your cytomegalovirus, okay, if it's in immunocompromised, it may cause kidney, eye, lung, and often it may damage the kidney, eye, lung, and often fatal. So for the congenital disease, okay, so the congenital disease that it may cause is it may cause congenital effect in the babies. Kasi po kasama siya dun sa inyong tinatawag na torch. Okay, torch panel. Torches pa nga, torches. Okay, the toxoplasma, the rubella, yung si CMV, and then yung tinatawag natin na ES, di ba, si syphilis. Okay, so torches. Okay, so this is the most common cause of viral mental retardation that can cause placenta, and this infectious mononucleosis-like syndrome is, ayan. Next, proceed naman tayo sa another subfamily, which is, ayan, EBV, Epstein-Barr virus that infects lymphoid cell. And then the lymphocytes can produce tumors and not isolated in the culture. Okay? Please take note that po that this type of virus can cause infectious mononucleosis and heterophile positive. Heterophile positive. Okay? It may also cause, Burkitt's lymphoma, nasopharyngeal cancer, oral hairy leukoplakia in HIV in patients. So what is the mode of transmission? It is also called as your Kissing's disease. Okay. And then your Epstein-Barr virus, it causes Epstein-Barr virus, the EBV, it causes exanthem, exanthem, okay, subitum, exanthem subitum. Okay, it is what we call the sixth disease. Okay, sixth disease. Or what we call the roseola. Roseola, R-O-S-E, roseola. Okay, it is the sixth disease. Okay, another subtype is the human herpes virus 6 and 7. 6 and 7 na po tayo. Sinasabi po na yung inyong 7, it doesn't have a known disease. However, yung 6 disease natin, it may be spread by your respiratory route. It may be spread through respiratory route. Okay, it may be spread through respiratory route, and then wait lang po. Ayan. So, in the meantime, ayan, medyo patapos naman na po tayo with the discussion. Pause ko lang. Okay, so going back, let us discuss the human herpes virus or the HHV8 that is known to cause Kaposi sarcoma, Kaposi sarcoma. And it is the #1 cancer in those with AIDS, #1 causative agent of cancer for virus with patients having AIDS. Next na po natin si adenoviridae, or coming from the agent or the virus involved is your adenovirus, and it causes yung ARD natin, your acute respiratory disease. And these are the diseases associated. We have the pharyngitis, conjunctivitis that may cause gastroenteritis in the children. Okay, so ito yung sinasabi nating adenoviridae na mayroong grape-like CPE, cytopathic effect, grape-like clusters in the cytopathic effect. Okay, so ano pong usual na specimen that we make use? We make use of the throat swab and the sputum. Okay, next natin si parvoviridae. Parvoviridae is the human parvovirus B19 and replicates in immature erythroid cells. Usually ang target niya, it has affinity towards immature cells, especially yung mga pronormoblast and normoblast. Okay, take note nyo po that it replicates in immature erythroid cells, especially yung mga pronormoblast and normoblast. Okay, next naman natin yung diseases associated such as yung mga erythema infectiosum, or the 5th disease. Kanina meron tayong 6th disease. Okay, dito po pumapasok si erythema infectiosum or the slap cheek rash. Okay, yung parang sinampal. Okay, slap cheek rush. Kala mo meron siyang, anong tawag mo doon? Merong blush on. Yung pala parang nasampal. Slap cheek rush. Okay, the erythema infectiosum. We also have what we call the transient aplastic anemia crisis. Transient aplastic anemia crisis. Okay, next naman po natin si Pox viridae with brick-shaped virion. Yung kanyang structure for the virion is brick-shaped. And then the viruses involved are variola, vaccinia, molluscum, and the ORF virus. Okay? So yung vaccinia virus natin, ito po, coming from the word, it is a type of virus that was used in preparation for the vaccine of the pox virus. Okay? Si molluscum naman siya yung tinatawag natin na wart-like tumor. Wart-like tumor. Ito. Okay, so the diseases associated includes contagious pustular dermatitis and eczema contagiosum, pakabulol. Okay, next naman po natin si papilloma viridae that causes your HPV. We have the HPV 16 tsaka 18. Okay, it causes cervical cancer. So, ayan. So, among all the cancer na listed, okay, we have only the HPV, the human papilloma virus, having the vaccine para po mapigilan yung HPV early on. Okay, yun lang yung may available. So it causes your what we call the human warts, skin and genital, and anogenital. Okay, so we also have the condyloma acuminata. Okay, next naman natin si polyoma viridae. Polyoma viridae, papunta na tayo doon sa dulo ng H happy. Si polyoma viridae, for the polyoma viruses, we have the BK virus and JC virus. BK, okay, BK virus, it is known to cause and damage and cause renal disease. Okay, the usual specimen of choice is urine, since renal disease. And lastly, si JC virus for specimen na ginagamit, CSF. Okay, so it is known to cause mild asymptomatic infection in children, hemorrhagic cystitis in adults, and may cause progressive multifocal leukoencephalopathy. Okay, next natin na DNA virus or last na DNA virus natin is si Iridoviridae. Okay, the iridovirus that is known to cause AFS or African swine fever. African swine fever. Okay, so next na po tayo. Yehey, nandito na tayo sa RNA viruses. Patapos na po tayo. RNA viruses. All are single-stranded. Pag mga RNA, single-stranded yan. Di ba? Kaya nga DNA, para mga deoxyribonucleic acid. So, double-stranded po sila usually. So, all of your RNA are single-stranded except reovirus. So, si reovirus daw ay hindi single-stranded. So, it may be double-stranded. Okay, so all of your RNA viruses are enveloped except yung PCR. PCR is an acronym for Picorna, Callici, and Reovirus. Picorna, Callici, and Reovirus. So generally, they are helical. Helical po yung mga RNA viruses natin except itong mga to. So ibig sabihin, can be either it can either be complex or icosahedral. So, si Callici, Picorna, Flavi, Toga, Reo, and Retro. Okay, so usually, mga RNA viruses po natin, by general rule, they replicate in nucleus. In cytoplasm, sorry. In cytoplasm. Okay? However, itong mga mababanggit po, they replicate in nucleus. We have the orthomixo and retro virus. So, si orthomixo, ito yung mga viruses natin, family ng viruses natin that causes influenza. Okay, influenza. So, the largest RNA virus is paramyxo and the smallest is picorna. Okay, so we also have the arthropod-borne. Ayan, ito mga nabanggit na to. So later, discuss na lang po natin. Okay, start muna tayo kay Togaviridae. The genus is Alpavirus or the arbovirus. So, ibig sabihin, pag arboviruses, they will be needing vector for transmission. Okay, needing vector for transmission. And we have the Eastern, Western, and Venezuelan equine encephalitis virus. And then we have mosquito-borne and birds as your reservoir. Okay, so these Eastern, Western, and Venezuelan is known to cause encephalitis. Okay, so yung chikungunya natin, ang vector niyan is usually mga Aedes mosquito. And then the genus rubivirus or rubella virus is known for being teratogenic, or it may give or cause to damage or affect yung mga fetal diseases natin. Okay? So, itong mga rubella na to, pakitandaan po si rubella. Si rubella is known to cause German measles. German measles po. Kasi meron pa tayong isang type of measles. German measles that causes congenital disease. Your German measles causes congenital diseases. Next, we have the Bunyaviridae. Bunyaviridae. We have the La Crosse encephalitis virus. The mouse is the host, and then the mosquito is the vector. We have the Rift Valley fever virus, Crimean Congo hemorrhagic fever virus, Hantaan Korean hemorrhagic fever virus, and the hantavirus. So what are the diseases associated? California encephalitis and pneumonia or the hemorrhagic fever. Yeah, next naman natin si Flaviviridae. We make use of plaque reduction test, or it is the most specific test for flavivirus. Bilugan nyo na po. And then meron tayo mga arboviruses, or the one that uses or make use of vector. So pag yellow fever and dengue fever, Aedes mosquito yung kanilang vector. Okay, meanwhile, itong tatlo, yung natira, si St. Louis, West Nile, and Japanese, ang kanilang vector is Culex. C-U-L-E-X, Culex mosquito. Okay, so it is known to cause encephalitis, dengue, and yellow fever. So yung dengue fever natin, yung mga dengue natin virus, it is under the Flaviviridae. Okay, so yung inyong dengue is also known as break bone disease, as in literal, break bone, i-break yung bone. Okay, bakit? Ba't siya tinawag na break bone? Kasi nga naman po, pagka meron kang mosquito, sobrang sakit ng mga joints mo, may mga spasm dyan sa muscle spasm. So, kaya po siya tinawag or also known as break bone disease. Okay, so under the dengue viruses, we also have what we call the NS1 antigen. It is for the dengue during recent and acute infection. So this is a serological test, since antigen test siya, to determine if there's a presence of your dengue virus in the patient's system. Okay, the hepatitis C virus under yung ating Flaviviridae, it is parenteral, causing from blood or sexual contact, and it is screened through your EIA. And then, anong tawag nito? And it is confirmed using Western blot. Okay, meron tayong screening test na tinatawag, and then meron din po tayong tinatawag na confirmatory or the Western blot. Okay, so the disease associated with your hepatitis C is your hepatitis C disease, and then it is known to cause chronic liver infection. Okay, next naman po natin si Rheoviridae. Okay, for the respiratory enteric orphan, the virus associated is rotavirus, and then the transmission niya is fecal oral route. Okay, it is the #1 infantile diarrhea, pakilagyan po ng underline, and then #1 cause of gastroenteritis in infants and children 6 months to 2 years during winter months, and acute infectious diarrhea. So balugan niyo na po yung mga information regarding diarrhea. Pag rotavirus, mga diarrhea agad yung nasa isip natin dyan, okay? Kasi fecal-oral route siya. Okay, next natin si Calciviridae or Calisi. Sorry, Calisi yan, hindi Calci. Calciviridae. The transmission is also fecal-oral route. And we have what we call the norovirus. It is a prototype strain is Norwalk. Underline na po. Sa porovirus and hepatitis E. So kapag ganyan, mga transmission yan, fecal-oral route. Fecal-oral route. Okay? So your Norwalk virus is known for having outbreak of diarrhea in the Norwalk, Ohio. So siguro kaya siya pinangalan doon. Okay? Kasi nagkaroon ng outbreak nung Calisi virus or nung Calciviridae having the norovirus. Tapos, so, ano siya, nagkaroon ng outbreak doon sa specific place ng Norwalk. Tapos pinangalan na after the place. Okay, next si Astroviridae for the astrovirus. Okay, next naman po natin si Arinaviridae, that what we call the sand-like virion, sand as in buhangin, sand-like virion. And it is known to cause lymphocytic choriomeningitis virus or the LCM. We also have the Lassa fever virus. The other viruses involved are also Junin, Machupo, and Sabia. So your Arinaviridae is known to cause aseptic meningitis and hemorrhagic fever. Okay, next na natin si Filoviridae. Si Filoviridae must be processed under or classified under BSL-4. Ma'am, bakit ganun kataas yung biosafety level niya? Because ito po si Ebola virus. Okay, natatandaan si Ebola virus. It is a monkey reservoir but transmitted to humans, and human-to-human transmission can be passed or transmitted through respiratory droplet. Respiratory droplet po. Okay, so endemic po ang inyong Ebola virus sa Africa. Although this is very dangerous pagka nag-spread yan dito. Okay, around Asia. Okay, so it will cause severe hemorrhage and 90% of mortality rate. So very fatal po yung ating Ebola virus. Next, si Coronaviridae or the coronavirus is we have the SARS-CoV or the SARS-CoV-2, the causative agent of your COVID-19. We also have the common colds for your Coronaviridae. Okay, next naman natin si Rhabdoviridae. Rhabdoviridae, dito po pumapasok yung ating rabies virus. Kapag ka naman po yung mga pasyente natin na nakagat ng rabies, it can be fatal if left untreated. Okay, pag hindi po na-vaccinan kaagad, yan, maaaring mamatay si patient. So, what is the gold standard for rabies? That is what we call the DFA. Okay, DFA is the gold standard. And the disease associated is rabies pa din or rabies. Okay, rabies. Okay, next naman po natin is yung Paramyxoviridae. Paramyxoviridae po natin. Pag sinabing Paramyxoviridae, yan po yung mga sinasabi natin na influenza. Okay? Pag sinabing Myxoviridae yan, si orthomyxo, paramyxo, mga mixo, influenza yan. So, meron lang silang slight difference. Pag paramyxo, we have 1, 2, 3, and 4. Bilugan ko na po muna. Okay, si Paramyxoviridae, si para-influenza virus, it is isolated from throat. In adult, it may cause upper respiratory tract infection. If in children, pwede pong magkaroon ng tracheo-laryngobronchitis, yung mga bagets natin. Okay, underline na po. Next, si morbillivirus. Morbillivirus, it is the causative agent of your rubiola measles. Okay, rubiola measles. Okay, natatandaan po, meron tayong German measles. Meron din naman po tayo na rubiola measles. It is what we call the 7-day measles. 7-day measles. Okay, so yung measles natin na to is SSPE or the subacute sclerosing panencephalitis. It is yung tinatawag natin na disease na po kung saan magkakaroon na ng complication of measles. Okay, the SSPA, complication of measles. Next na po natin si mumps virus. Si mumps virus, it infects yung salivary glands. Okay, salivary glands. Natatandaan si mumps sa Tagalog, si beke. It can infect the testes, ovaries, and kidneys and isolated from throat swab or urine. Alam niyo po, usually mga viruses natin, they are self-limiting. Okay, yung katawan na po natin, lalabanan ng mga WBCs natin yan and usually gagaling naman tayo if hindi fatal naman or common lang naman yung mga viruses na kakapit sa atin. Okay? Said, it is known to cause mumps or the orchitis. So, kapag ka po malala yung mumps, it can lead to orchitis or the inflammation of the testicles. Okay? Although, it infects yung salivary gland. So, pansin nyo dito po siya banda. Sorry, hindi nyo nakikita, no? Banda sa may leeg banda. Okay? Kasi dito yung salivary glands natin. Kaya, mataba yung banda sa may ilalim ng pisngi. Okay? Next natin si respiratory syncytial virus. It is known to cause bronchiolitis, pneumonia in infants. Yung RSV or respiratory syncytial virus, it is with your tinatawag natin na fusion protein. Okay, meron po siyang fusion protein. Ano pong ibig sabihin nun? It is where the infected cell infuse or nagkakaroon sila ng pagsasama or joining together para makabuo sila ng mas malaking cell. Anong tawag natin dun sa process na yun? Syncytia. Again, there is a fusion of protein wherein there is infected cell infused together to become large and the process is called syncytia. Okay, kaya siya si respiratory syncytial virus. Okay, last na po natin is what we call the human metapneumovirus. Yan, that is under Paramyxoviridae. Next naman po natin si Orthomyxoviridae. It includes your flu viruses. Okay, and the two important surface antigen is yung tinatawag natin na HA tsaka NA. Listan nyo na lang po dito, surface antigen HA tsaka NA. Okay, anong meron kay HA tsaka kay NA? So, yung tinatawag po natin na HA, it is responsible for the attachment. Okay? Yung tinatawag naman natin na NA, yung neuraminidase natin, NA, neuraminidase, it assists in the release of the virion from host cell. Again, your HA, it is for the attachment, and yung NA, neuraminidase, it assists in the release of virion from host cell. Okay, so these are two important surface antigens as they have uses in the next following discussion. Okay? So, for the subtle CPE or the heme absorption, so meron po tayong tinatawag na antigenic shift at saka antigenic drift. So, ito pong mga dalawang to, these are slight changes in the cell or yung mga mutation. Diba? Meron pong mutation. So, si antigenic shift, pakilagay po dyan sa inyong mga notes, it is a major mutation. Okay, major mutation. Yung ating antigenic drift, this is a minor mutation. Okay, so pag nagkaroon daw po ng mutation with the cells of the virus, yung inyong antigenic shift, okay, antigenic shift, since this is a major mutation, it may cause or it is the responsible for pandemic. Okay, so yung mga viruses na yun, it may cause pandemic. Meanwhile, in the antigenic drift, since this is a minor mutation in the cell of the virus, it is the one responsible for the local outbreak. Local outbreak lang po. Okay? So, next natin si influenza A, it replicates on various type of cell. It replicates on various type of cell. Hindi lang po sa human cell. Pwede rin po sa mga animal cells. Okay? Yung influenza B naman natin, it replicates in human viruses. So, pansin niyo po, kaya po walang mga pandemic type or wala pong pag-spread globally yung ating influenza A kasi hindi siya makapag-mutate dahil, hindi makapag-mutate, parang hindi siya makapag-undergo ng inyong antigenic shift since it is passed through other cells. So, hindi lang human cells yung nai-infect niya. Okay? Even yung mga animal cells. So, hindi siya makapag-mutate to cause pandemic. Okay? Next naman po natin ayan. So, again, yung associated diseases natin is influenza and mild influenza. So, next natin si Picornaviridae that is known to cause yung kanyang causative agent. So, under ng family na to is the genus Enterovirus. So, it is the enterovirus is acid stable. Paki-take note po, this is acid stable. Okay? Yung mga viruses under that one is the poliovirus, Coxsackie A, and Coxsackie B. So, yung inyong polio, it is known for infantile paralysis. Infantile paralysis. Okay? So, infantile paralysis or flaccid type. Ibig sabihin, pag may flaccid, FLACCID, pag flaccid type, there is an unresponsiveness of the muscle. Again, unresponsiveness of the muscle. Next, si Coxsackie A. Si Coxsackie A, this is the one responsible for hand, foot, and mouth disease. Ayan, hand, foot, mouth, and disease. Okay? Si Coxsackie B, siya naman po yung tinatawag natin na Bornholm disease. Born, as in pinanganak, Holm, Holm disease, or the devil's grip. Devil's grip. Devil's grip, GRIP. Okay, this is a flu-like virus that causes myocarditis and pericarditis. Okay, so your Picornaviridae, the transmission is fecal-oral route. Fecal-oral route. Next natin yung mga ecoviruses ninyo or the enterocytopathogenic orphan. Number 1 natin si rhinovirus that is limited to your upper respiratory tract. Kapag rhinovirus, anong naaalala natin dito? That is yung mga common colds. Na sobrang dami. Kahit maubos natin yung lifetime natin, umabot ng 100 plus, kahit araw-araw ka magkaroon ng common cold, hindi mo makukumpleto lahat ng strain. Yan, sabi ng prof ko dati. Okay? Please take note po ng inyong mga rhinoviruses, they are acid labile. Acid labile. So, sinasabi nila pag may sipon ka, uminom ka ng mga acidic na drinks, such as yung mga lemon, calamansi, because your common colds or the rhinoviruses are acid labile. Okay? So, under pa rin po ng ating enterovirus is the Hepa A virus. Hepa A virus, again, this is a fecal-oral route, and it is known to cause Hepa A with short incubation, abrupt onset, and low mortality. So, there is no carrier state. Okay, next natin si Retroviridae. Retroviridae, these are two more viruses. And then, meron siyang tinatawag na enzyme. So, ano pong unique na feature ni ating Retroviridae? Meron siyang reverse transcriptase. Reverse transcriptase. So, ibig sabihin ni reverse transcriptase, it allows viral RNA to replicate into DNA, tapos RNA to RNA. So, supposedly, ang ating mga viruses on a normal basis, pag nagre-replicate sila, kung RNA sila, pag nagre-replicate sila, RNA ulit sila. Okay? Since there is a unique characteristic of our Retroviridae, it can undergo reverse transcriptase. So, from RNA, pwede mo na siyang maging DNA, then RNA to RNA. Okay? So, it replicates in nucleus and cytoplasm. Okay? And the next naman po natin is yung tinatawag natin na hepatotropic viruses. Hepatotropic viruses, we have the HAV or the HAV. It is a hepatitis A virus for the under Picornaviridae and infectious hepatitis. So, tandaan nyo po sa mga hepatitis natin na viruses, yung A tsaka E, okay, sila lang po yung fecal-oral. Okay, fecal-oral, ibig sabihin, these are bowels. Ito, mnemonics natin, no, bowels. Okay, and then, katunog niya, vowel. Again, baligtad. They are vowels. Okay, katunog niya, bowel. Okay, kaya nga si HEPA A and E, fecal-oral. The rest of them, they are parenteral or blood transmitted. Okay, tandaan, wag na wag pong kalilimutan na HEPA A, HEPA E, these are vowels. katunog ng bowel or pupoops. Okay, sila lang po yung fecal oral route. And then tandaan po ninyo yung inyong HDV, this is HD, sorry, hindi yan HCV. HDV, this is an incomplete virus. Kailangan niya po, kulang siya. Okay? Kailangan niya po si hepatitis B para mag-replicate. Okay? It needs hepatitis B to replicate. Okay, so the rest of the discussion, itong mga kasunod na slides na po natin, paki-take note na lang po at sagutan. Okay, so meron po tayong recall question dito. Which of the following is an RNA virus? Tamang sagot natin dyan ay, yes, letter A, Pseudomyxoviridae. Lagyan po ng star, this is a recall question. Okay, wag po kakalimutan si H, happy. Okay, 4 na P, tapos I. Okay, what is the largest DNA virus? Largest DNA virus, tama po, pox virus. Okay, pox virus. Lagyan na rin po ng star. Okay, so these are my references and thank you so much po for bearing with me. Sorry, may sakit ako kanina. So, nire-record ko to gabi na. So, pasensya na po kasi hindi ko natapos yung ating discussion. Tapos, ang dami ko pang break time kasi nga Ma'am Trina was not feeling well. So, if you ever have questions or clarifications, please do not hesitate to contact me and please see you around. Okay, so good luck on your endeavors. Thank you so much, Perpetua Rojas. I hope to see you soon. Thank you.